doing all the things it's supposed to do, some of the things it's supposed to do is make clotting factors, which means alcoholics tend to bleed more. Does that make sense to you? If their liver, which does over 500 different things, is not working properly, and one of those, or some of those things that it's supposed to do is make clotting factors, it can't make clotting factors, they start bleeding, they're going to continue to bleed. They're going to say they have thin blood, and you're just going to walk away shaking your head. There you go. Now, the problem with this, when these esophageal varices rupture, when they tear, as a result of chronic reflux, and they suddenly have this amount of blood that is emptying into their esophagus, they're going to go, so it's going to look like they're throwing up blood. But is that blood coming from the stomach? No, it's coming from the esophagus. But it's going to look like somebody turned on a faucet. Or they'll projectile this across the room. This could be bad. It could be bad because if they're alcoholics and their liver's not working, they're not making clotting factors, and now they're losing a lot of blood, even if it's venous blood, they're still losing a lot of it. That can be dangerous. Don't be an alcoholic, boys and girls. No, 12 steps. All right, circular folds called plicae circularis. That finger-like protrusions, the villi. I've talked about these. Where's the picture? There it is. Okay. Notice how this villi. This is not something that moves. This isn't pushing something along. The only reason it is there is to increase surface area, to increase absorption. So that we have molecules that are passing across this way. They're coming across this way. So these molecules are going to be able to find a way into the cell over here, or over here, or over here, or over here, over here. And when it gets through the cell, it's going to get to the blood, and then from the blood to the liver, and then from the liver decide what to do, move to the rest of the body. The condition of the inability to digest the sugar in milk. The sugar in milk is called lactose, which is actually just glucose and what? Glucose and galactose, right? Nobody knows. Okay, nobody cares. We have to have an enzyme to break this down into something that we can use. Does everybody follow that? This sugar we cannot use if we don't have an enzyme to break it down into something that we can use. The enzyme that we use to break this down is called lactase. Lactase is the enzyme that breaks down the sugar molecule lactose. You can tell it's an enzyme, by the way, because it ends in ase. Anytime you hear that, like lactase, amylase, protease, you can tell these are enzymes. So lactase breaks down the sugar molecule lactose. Well, if a person doesn't secrete lactase, then we say they are lactarded. No, we don't say that. We say they are lactose intolerant, which means they can't break down the sugar. What happens if you can't break something down? If you ingest something that you can't break down, what happens to it? Keeps going through. It keeps going through. Now, the problem here is we have all this bacteria in our gastrointestinal system that will say, look, if you're not going to use this sugar, we will. So now we have all this bacteria that will also break this down. And when they break this down, they're going to create their own waste products, some solid, some gas, which is going to cause an osmotic diarrhea. It's also going to cause that bloating and pain. They will not die from this. They think they will. They will not die. Some people can become lactose intolerant. In other words, they weren't earlier in their life, but later on they are, simply because their body isn't making lactase anymore. Some people can be lactose intolerant early in their lives, but become less and less lactose intolerant. Some people can be somewhat lactose intolerant, where they can eat some things, but not a whole lot. They can't like drink a whole big glass of milk, but they can put a little bit of cheese on their sandwich. So there are degrees of lactose intolerance.
Is that safe for them to eat a pint of Haagen-Dazs?
I'm sorry?
Is it safe for them to eat a pint of Haagen-Dazs?
A pint of Haagen-Dazs?
Yeah, I haven't heard of this. He was lactose intolerant.
Eat the enzymes.
He was going to eat. Not going to make him really sick. It's going to do it anyway.
It would just give them a lot of diarrhea and bloating. I wouldn't recommend it if it's like a first date or something. That could end.
Oh, the second.
That could second one.
Put that on Match.com.
I'll use the loofah. So, if we can't use that stuff, then it goes through. What's left over is waste. So it moves in to the large intestine. It has to go through the ileocecal valve first, goes into the cecum. Large intestines, absorbing water. We get some of those vitamins. You know those bacteria that live there? Some people say they're good bacteria. I say they're not good. They're not bad, but they're not good. Because if that bacteria moves into our blood, we got a problem. One of the nice things is they make things like vitamin K for us. We'll take some of that. Get rid of the waste. There's no villi, but you'll notice there's these big puckered pouches. There's no villi, but we do have these big puckered pouches that are going to move things along. Vermiform appendix. Notice here's the ileum. Here's the iliosphincter, ileocecal sphincter. Notice right down here, is the appendix. So as things move from the small intestines into the large intestines, they can go into the cecum, this first part here. Here is the appendix. So stuff can drop down from here into here, especially if it's heavy. Like the fecalits, little hardened masses of feces, or attached to something sometimes. All right, quick overview of what's happening here. What we're basically left with is waste and water. We can decide whether or not we want to keep water, get rid of water. So we're going to move from the cecum, this short little pouch, we're going to go up. Going up is the ascending colon. Then we are going to make a bend right here. This is called the hepatic flexure. Is it in the book? I don't know if it's in the book. I don't remember. It's the bend. The ascending colon comes up to the bend, and then it comes across the transverse colon. There you go. You can see it right there. There's a little hook. That goes right there. There's a hook. There's a hook. There's that hook. Transverse colon, you can see why it's named the transverse colon.
It's the appendix.
Then there's another bend at the splenic flexure. Then it goes down into the descending colon. And then we have this part right here, this S-shaped part. This is the sigmoid colon. The sigmoid colon is the only part of the colon that begins with an S, and it happens to be S-shaped. So the sigmoid colon is right here. And then there's a straight part for storage called the rectum. The anal canal and the anus is the muscular sphincter, where we have, once again, control. The vermiform appendix, now here, right here, if you look, is a 3-inch long slender hollow dentin tube, has no known purpose. That's not true. We know it's a lymphoid tissue, so it definitely has a purpose. Stop writing that. Understand this also. Read right here, it's a 3-inch tube. It can actually be up to 8 inches. It can be a long, really thin tube, up to 8 inches.
That's this guy right here?
I'm thinking yes. That's that guy right there, yes. The vermiform appendix. Appendicitis, inflammation of said appendix. Cecum, we've talked about that. Colon, we've talked about those. Talked about that. Appendicitis. The triad of appendicitis. Do you know what the triad of appendicitis is? Nausea, vomiting is 1.
Rebound pain?
Fever is 2, and rebound tenderness is 3. Why are you on that side?
No, I'm just holding.
Oh, I
It's
thought you
over
were
here.
at rebound pain?
No.
50% of patients who have active appendicitis have that triad. 50%, that's pretty big. 50% of patients have those 3 things. Big deal. So, of course, you have to take it out. Remember I told you how to find McBurney's point where you take out the appendix, where the appendix is located? You go from the anterior superior iliac crest to your umbilicus, and you go 1/3 the distance towards your umbilicus, and that is McBurney's point. Where you'll find it. There it goes. Oh, there it is. Never mind. Don't listen to me. Just look in your book. Right there. Diverticulitis. Diverticulitis is an inflammation of the diverticula. Diverticula is an outpouching of the intestines. These little areas of intestines just pop out. Now, understand, this is something that we only see in industrialized countries. You don't see this in third world countries. The reason for that is because we eat so much processed flour, that white flour, and our body, it doesn't work as well in our body as the whole grain flour that people should be eating. It doesn't have that sponge effect. It doesn't draw water to it. Now, what that means is the intestines have to work harder to squeeze things through. And this isn't you thinking, I have to work harder to squeeze things through. Your intestines are doing this all on their own because things are not moving smoothly. That creates extra pressure. That pressure is what causes these little outpouchings to pop out. Most every place else in the world uses a lot more whole grain flour, so they don't have that problem. That has that fiber effect that's going to draw water in. Draws water into the intestine, that keeps everything smooth, keeps everything moving along. Make sense? Because if something gets stuck in one of those little outpouchings, like a fecal lick or a seed or something, it can cause an inflammation, which can cause pain or infection, even perforation, worst case scenario. Now, we eat a lot more white flour than we realize. You might think, I know why that's right. When you get pizza, most of the time pizza is made on dough with white flour. When you go to Olive Garden, most of the pasta you get there is mostly made with white flour. When you go to Wendy's, the cheeseburger you get is made with white flour, the bun's made with white flour, and salt that doesn't have any iodine. Just saying. So we eat a lot more white flour than we realize, so keep that in mind. I want to get through a little bit. I want to get through all of this. Okay, you can see it there. You can see this little outpouching. Colostomy, this means that we have to create a new way for the feces to leave. It's not always permanent. It can be something that's just temporary. But defecation. You know what defecation is?
Yeah.
Fecal matter moves through too rapidly, not enough water is removed, and diarrhea occurs. Do you know what kind of medication? What do you take for diarrhea? What's that medication called? Imodium, right? Do you realize what Imodium does? It doesn't take water out. No. All it does is it slows this process way down, which allows the water that's there to be reabsorbed.
Banana.
And if we want things to move along faster, what do we take? Anything with fiber is the correct answer, because yes, laxative. But anything with fiber, because that's the main first ingredient in pretty much every laxative on the planet. Why? Because it's going to pull water. Fiber is going to pull water into the lumen of that tube, which means everything's going to move faster. Okay. We have two anal sphincters, internal and an external. Internal's involuntary, external is voluntary. We'll see this again when we talk about the urinary system, so it's not really a big surprise. As the rectum fills with feces, defecation reflex occurs, causes the rectal muscle to contract and the anal sphincter to relax. When the feces in the rectum wall stretches, triggering this effect. Bacteria help break down adjustable materials, but they're doing it for themselves, not for you. And again, vitamin K. The liver, gallbladder, pancreas as accessory organs. Liver is a big organ, does over 500 different things. A lot of blood coming through it because all that stuff that we're ingesting is going to get through there. You can see here its location as compared to the pancreas, as compared to the stomach, and the gallbladder. Notice we have the cystic duct coming from the gallbladder, we have the hepatic duct coming from the liver, and so of course they're going to join together and become common. Detoxifies a lot of stuff, metabolizes a lot of stuff. If you've not heard of the cytochrome P450 enzyme, have you heard of this? Have you heard of cytochrome P450 enzyme? It's actually a group of enzymes that help to metabolize things, like help to metabolize medications. You'll know about it. Forms blood plasma proteins, clotting factors, anticoagulant, bile, stores glucose as glycogen, creates urea to be removed, makes cholesterol, stores vitamins. So you see a lot of things. Over 500. Bile emulsifies fats. Bile helps transport bilirubin and excess cholesterol to the intestines for elimination. So does fiber. Bile leaves the liver by the hepatic duct. I already talked about that. The portal system, including the portal vein. Here's the thing about the portal vein. The portal vein is actually not a true vein. Because, bless you, most veins are going to branch into larger veins. In other words, they're going to empty into larger veins, which are going to empty into larger veins, which are eventually going to empty into the vena cava. The portal vein doesn't quite do that. The portal vein actually takes these nutrients that are being absorbed and brings everything to the liver, and then branches off into smaller veins so that this blood can have those nutrients removed as it goes through the liver, and then it comes back together, eventually coming into the inferior vena cava. So the portal vein is not really a true vein in that sense. It doesn't go directly to the heart. It sort of goes to the liver first. Portal hypertension occurs when blood flow is obstructed through the portal system. Long-term hypertension results in varices. We've talked about ascites. That's a fluid that's going to fill in the abdominal cavity. Splenomegaly, we know what that is. Hepatic encephalopathy. If the liver's not doing what it's supposed to do, if it's not getting rid of different products, if it's building up bilirubin, it's not conjugating bilirubin, we're going to end up with things occurring in the brain. Especially, you see that with physiologic jaundice in the newborn. think of what cirrhosis does to a liver, sort of imagine a liver cell that just dies, but doesn't really become necrotic. Think of it as like a liver cell that's being filled up with concrete or something. That's going to just solidify. So it's there, it just doesn't do anything. And it's more in the way than anything else, and it's going to restrict blood flow past it. You can see the varices here. That's what those are. Esophageal varices. That looks like that's pretty ruptured. Gallbladder. We've seen that already in the liver, storing bile. Releases it when cholecystokinin tells it to. Squeezes it. So if somebody has those gallstones collecting in there, that's going to hurt, because gallstones are actually pretty smooth. They feel like river stone, something you find down by the river that's been there for a while. But just like if you put a bunch of those in your hand, you squeeze really hard, it still hurts your hand. So that's what happens when they're filling up in the gallbladder and it squeezes around it. It's quite painful. Hepatitis. This is an itis, inflammation of the liver. Types of infectious hepatitis: A, B, C, D, E, F, G. Oh, they don't have it there. That's fine. You know there's more hepatitis, right? You know that it goes beyond D.
Yeah, they have it in the book.
Do they? E, F, G, H? Or E, F, G? Those two, the last two are really new. Hepatitis E and A both follow the fecal-oral route. In other words, from waste into water, and food supply somehow, and then back into the person. Fecal-oral route. Hepatitis A, you'll hear about every once in a while. This can actually cause splenomegaly too. This can actually cause the spleen to fail. Hepatitis E, the other fecal-oral route, is not found in the United States, more Asia. But hepatitis E is the one that kills pregnant women, interestingly. Hepatitis B is the only DNA hepatitis virus. The others are RNA. We have a good working vaccine against hepatitis B. So the number of hepatitis B infections are actually gone down. Number of deaths in hepatitis B has actually gone down. Hepatitis C, on the other hand, we do not have a good working vaccine for it. So deaths of hepatitis C are actually on the rise. Infections are on the rise. Then we have hepatitis D. This guy's an oddball. Because a patient can't be infected with hepatitis D. Have you heard of this?
Yeah.
Without being infected with hepatitis B. Well, why is that? Don't know.
Is it a morph? Is it a morph version of B?
One would think, but hepatitis D is an RNA virus. Hepatitis B is a DNA virus. It wouldn't take that. It wouldn't take that leap. If they were both, the same kind of instructions, then yeah, it would make sense. That would be your first thought, or at least it should be. So why hepatitis D can only exist when there's hepatitis B? No, I have no idea. I don't know if anybody knows, but I certainly don't have any idea. And why?
It's a super infection. The book does.
Like Superman?
Super infection.
Cool. That's awesome.
Like
If I'm getting an infection, man, that's what I want. I want something super. Oh, but I've been vaccinated. Pancreas. Pancreas is located posterior to the stomach, triangular in shape. The base of the pancreas is tucked inside the duodenum, first loop of the small intestines. The body lies more horizontally, tapers to a point. Excuse me, the tail of the pancreas. I don't think so. None of the other people I was working on in West Africa had, except for the patients. Tapers off to a point next to the spleen. The pancreas, remember, is part of the endocrine system, releases a lot of important hormones like insulin and glucagon. But here, it acts part of the digestive system, which is going to release enzymes. And you can see all these enzymes end in A's. Carbohydrates, amylase. Same thing.
Carbohydrates and amylase are the same thing?
Yeah, because that's what amylase does, it breaks down carbohydrates. It's not just me, is it? Okay. What is lipo?
Fat.
Right, okay. Proteinase, that kind of tells you. Nuclease. Nuclease is divided into RNAs and DNAs, break down nucleic acids. All right, notice here, the pancreas is tucked inside of this loop. Cholecystitis, inflammation of the gallbladder, most common cause of cholecystitis, cholelithiasis. Cholelithiasis, the gallstones. Most commonly caused by cholesterol. Blockage causes a backup of bile in the liver, can cause jaundice. Cause the liver not to be as effective. Type it out. Pancreatitis, most common cause of pancreatitis, alcohol, followed then by gallbladder, gallstones, and smoking. No, I just threw that one in there that time, but it might as well be. Pancreatic cancer is different. Pancreatitis does not mean it's going to lead into pancreatic cancer. Somebody can have pancreatic cancer without being an alcoholic, without any sort of gallbladder problems or anything else. Vomiting, diarrhea, constipation, abdominal pain. You all know those, right? Vomiting is a protective mechanism. Do you know who cares if you vomit? Nobody. Your mother. That's the only person who cares if you throw up. You'll hear, yeah. You'll hear people say all the time, as students coming into a class like this, oh, they can't take the test. They were all morning. They were throwing up. We throw up for a reason. We throw up because something has come in that we don't want, so we get rid of it. And then that's pretty much it. That's why we vomit. It doesn't mean that a person is less healthy. It doesn't mean that they're deteriorating in any way. It doesn't mean that they're going to die. It's not like saying, well, I had a fever of 100 this morning, but now I have 103-degree fever. That's a problem. But not, oh, I was feeling sick this morning, then I threw up. I don't care. People say, well, there was blood in the vomit. Probably. Everybody in here has vomited before in their life. This is a very violent process that is causing things to occur in reverse. Yeah, there's going to be problems. Of course there's going to be small tearing that occurs. Yeah, you're going to see a little bit of blood in there, unless it's mom's spaghetti. And you won't be able to know. People get way upset with the vomiting thing. There are times where it's important. Most of the time, it's not. Most of the time, it's people just overreacting. I had a headache and I was throwing up in the bowl. Give you more. Diarrhea, now this is a problem. Now, of course, both with diarrhea and vomiting, especially in young children, what are we concerned about? Dehydration, of course. Good, an electrolyte. But dehydration. Constipation, what are we concerned about? You have to be clear in impaction. That's the worst. Yeah. That's really all you have to worry about. Constipation could be the result of obviously a low fiber diet. The worst case scenario would be something like Hirschsprung's disease. Have you heard of this? Where the nerves are not sending the signal to the muscles, so at a certain point stuff's not getting pushed through, which means everything's just backing up.
Prenatal vitamins.
Causes something called megacolon. Look that one up. Megacolon. Yeah. Megacolon. Next. All day Sunday. Sunday. Yeah, that's the sound. Megacolon.
That's pretty wild.
It's like Roadhouse. Megacolon. Yeah.
That's somebody's hand at the upper part of the screen.
Yeah, that is megacolon.
I don't want that colon.
Yeah, no.
That's
No, you
not
don't.
funny, right?
Because you don't want to be full
Because we don't want that.
of, stuff. You don't want to be full of badness. Peptic ulcer disease, we've talked about that a little bit. Deoxybacter chloride, we talked about that. Abscess is infection. Anorexia. Anorexia, first of all, the term anorexia simply means a decreased appetite. It does not mean that somebody is thin, they think they're fat, so they don't eat. That's a psychological disorder. That's anorexia nervosa. That's different. Anorexia means a person just has a decreased appetite. Every one of us at some point in our life has had anorexia. If you've ever had the flu, if you've ever been depressed, for whatever reason, you just didn't feel like eating. We've all had this. Bulimia, this is an eating disorder. This one's a little more difficult to see because these patients usually are within the normal limits for weight. So they will binge and purge. They will eat and throw up, or eat, take a bunch of laxatives, or eat and go on a treadmill for 4.5 hours, or eat and then not eat the next day. Most common, excuse me, the most common disease in the world, dental caries, tooth decay. Cholecystitis, inflammation of the gallbladder, cholelithiasis, those are the stones, cirrhosis, chronic disease of the liver, cleft lip, cleft palate. Have you seen this before?
Yeah.
The lip right here, or right here, or on both sides does not form completely. Remember, our faces form together this way in the uterus. They form like this and then down like this. So we have this little philtrum right above here where our face met, where it came together. Well, when they were building this part of the face, the directions for that little area was not included. So that area got skipped. Idiopathic, although it's assumed that smoking and alcohol play a role. Easily corrected with surgery, the cleft lip. Cleft palate's a little more complicated, yes?
Certain medications can cause it too, and they've already tried mentioning.
Which medications?
Topamax.
Janet? Doesn't Topamax also cause, not Bacterial syndrome, isn't it teratogenicity? That is much more severe, like life-threatening? I thought it was much more severe than this. That was my understanding. That was like, you don't give it to pregnant women because of that reason, not because of tough lip. Maybe not.
I'm not gonna stop
Yeah.
there.
No, I do this because I can't. And I don't even do this one. Cleft lip.
What?
Cleft lip. This is an easy fix, but if if we don't have, if the patient doesn't have access to surgery, they'll live like this. The problem with this is it's difficult to eat with a cleft lip or a cleft palate. If you try and hold food or liquid in your mouth with a big opening right here, it makes it really difficult. Crohn's disease, have you heard of this?
Mhm.
This is actually an inflammatory bowel disease. This and ulcerative colitis usually go together as the inflammatory bowel disease. This one, however, affects areas closer to the upper portions, upper into the ileum, whereas ulcerative colitis usually affects the lower portions. Diverticulitis, we've talked about that. Enteritis, inflammation of the intestines. Esophageal stricture, we can see that in Mallory White stuff. Esophageal varices, we talked about that. Fissures or cracking, gastritis. Inflammation of the stomach, it's either acute or chronic. It's either infectious or non-infectious. We talked about those things. Hiatal hernia, this is where some of the stomach is protruding up through the diaphragm. Inguinal hernia. Remember, hernia is any time part of an organ is moving through an area it's not supposed to. Intussusception, this is when the intestine is actually moving into a preceding portion. All right, talk about bulbous, also known as malrotation. This is a twisting. That's a surgical emergency because that patient will have their intestines twisted around, which means the blood vessels that are bringing blood to those intestines is being twisted around. So we're basically putting a kink in the blood supply, which means these patients are going to have no blood supply to the intestines, which means they're going to be necrotic soon. How long?
So,
How long would you guess? About 6 hours. I would guess about 6 hours. Alcoholics are going to need thiamine, vitamin K for those patients who are on Coumadin and need surgery. You have vitamin K in fresh frozen plasma.